I'm going to say some words that I did not expect to say in 1996. I miss Bill Clinton. I really miss Bill Clinton.
I saw you, when I brought it up.
I really miss Bill Clinton.
My issue, and especially coming from Australia, where it is largely socialized healthcare system, people are dying, waiting for ambulances now.
That's true.
Like, people are literally not getting the care that they need because they've become so reliant on the government.
The way socialized medicine operates, they want you to die waiting for care rather than delivering the care.
What? Can you explain, can you elaborate on that just a little bit?
So let me give you two, do you really want to get into the weeds on this?
Let's do it.
We want to help these people. And he goes, no, I just want a 3-day detox. You think they're not going to go out and relapse again after 3 days? He goes, oh no, they may relapse. But if they relapse 3 times, then they're no longer my concern.
China's been buying up U.S. farmland at an accelerating pace.
Yeah, this is a Chinese national fresh from Wuhan.
Did you say Wuhan?
Exactly. I mean, that's where the COVID virus came from, people. You do not need to set bombs off to start a war.
These people, they are the enemy of the American people. We should do everything we can to stamp them out.
Both political parties are 100% full of shit when it comes to this issue. We need to protect property and businesses in the United States. Full stop.
I actually agree with him.
All right, guys, welcome to Her Take. Please don't forget to subscribe, click that bell notification. It helps us out a ton with the algorithm, and you'll never miss a show. This gentleman to my right is Dr. Drew Pinsky, double board certified claims physician. Yeah, pretty impressive. Not too shabby.
Yeah, I had a lot of energy when I was younger. That's what it boils down to. I look at that. I was doing some. We were flying next to each other last night. I was doing some board upkeep, and I thought, wow. Back in the day, this was nothing. Now it feels like a lot.
Well, it's a lot because you also continue to shape public dialogue with your show that streams on Rumble, Ask Dr. Drew, as well as the Adam and Drew podcast.
We are still together, Adam and I, which is ridiculous.
Good reason.
30 years.
I love it.
Yeah, well.
And we love you, and we love both of you together.
We haven't killed each other yet.
You know what? That's because you're both friggin' awesome.
Thank
Honestly,
you.
Doc, if I could just take a moment to appreciate you.
Jillian, stop it. It's a pleasure to be here, and that's that. It really is a privilege. Congratulations on the show, guys. It's going great. So
Thank you.
I want to be a part of it.
Well, you are, and it's long overdue that we've had a Maha-esque kind of a show, and I'm sure we will, fall into other categories along the way, like California and the craziness there. But, Maha is one of the biggest political movements in the country.
Yes.
And it's hard for people to disseminate all of the information that's out there, from gain-of-function research to vaccines.
Yeah.
So here's what's up for today, guys. First, I'm sure you saw that Secretary Kennedy fired 17 members of the ACIP. Now, this is the Advisory Committee on Immunization Practices, and he subsequently hired his own staff. CNN responds by citing 250 studies that they crowdsourced to say that they have effectively disproved Kennedy's claims about lack of proper vaccine safety testing. So we're going to break this down in detail for you. What's true? What isn't? What does it mean for you and your family? Next, we've got cuts to healthcare and food stamps. So everyone's pointing the finger at Republicans, but there's a lot more to the story. Who's getting cut and why? Lindy's going to give us the details on that. China is smuggling in bioweapons and buying up farmland across the U.S. Not at all terrifying. We're going to take a broader look at bioweapons in general, including gain-of-function research, which are concerns that we're facing in the future going forward. Plus, what are the very real costs of social media on our mental health? And why isn't Gen Z interested in sex? This one is Anna's. And are you sure about this?
I am sure about this, yes.
All right.
Young people are not banging. Why?
It's terrible.
We need to discuss.
It's true.
It is
All right,
true.
well, we're going to get to that. So that's going to be very sad, though.
Yep.
Okay. All right.
Yeah.
Here we go. As mentioned, we're going to start at the top. Kennedy canned 17 members of the ACIP, and the legacy media flipped out. Measles for everybody. He's taking us back to the dark ages. He's a dictator. It's politically driven. So here's a New York Times article. You can see for yourself. Party politics is said to have played a role in Kennedy's firing of vaccine advisors. Are they right? Well, let's begin with his tweet where he retired 17 people at the ACIP. All right, so can we read it? Yesterday, I retired 17 members of the Advisory Committee on Immunization Practices, or the ACIP. The CDC.gov, their external panel that wields the grave responsibility of adding new vaccines to the recommended childhood schedule. Over the coming days, I will use my platform to announce new members to populate the ACIP. None of these individuals will be ideological anti-vaxxers. They'll be highly credentialed physicians and scientists who make extremely consequential public health determinations by applying evidence-based decision-making with objectivity and common sense. Now, if I could just highlight a few more things that you should know about this. In fact, that is true. Everybody that he has appointed so far is either a PhD or an MD. And here are a few names for you to look into yourself. So Dr. Martin Kulldorff, he went to Harvard Medical School, and he's a national expert in vaccine safety. Dr. Cody Meisner, he went to Dartmouth Medical School, and he's a national recognized expert in pediatric infectious disease. Dr. Michael Ross, he's an OBGYN with expertise in hormone therapies, antibiotic trials, and immune-related conditions. Last but not least, why did he fire these people? When I reached out to Kennedy's head of comms, here's what they told me. Not one member of the ACIP ever rejected one vaccine. Not once, not ever, despite the fact that some of them were later removed for safety concerns. Next, 97% of them never bothered to fill out a conflict waiver, which is ironic because now the New York Times is going after some of his picks, suggesting that they worked with pharma companies. All right. She's not a doctor, my bad. Charlotte Moser, who was on one of the ACIP members he filed, her best credential was a master's degree in communications. And she advocated for restricting unvaccinated people from parks, pools, water parks, government buildings, theaters, sports venues, shopping centers, and other public accommodations. And last but not least, Noel Brewer, who was also fired by Kennedy, received vaccine-related grants and compensation from Merck, Pfizer, and GlaxoSmithKline. So, what do we think here? Doc, I'm going to start with you.
Got a million thoughts. First, I'm wondering if Charlotte Moser was in support of the No Kings demonstration, since she wanted to be a king and restrict you to your home and tell you how to handle your body. I mean, everybody needs to examine what they did during COVID. It was so revealing. If you finked on your neighbors for having a barbecue, if you felt that people who were unvaccinated should be withheld from getting health care, any of those things, you would have been a prison guard in Nazi Germany. That's you. That's who you are. Look at it. Don't do it next time. Charlotte Moser is one of those people. That's that. This morning, not only did he get rid of the 17 ACIP members, but he got rid of their support staff this morning.
Oh, wow.
Because those are the people actually making the decisions in the government. You know that bureaucratic underbelly are the ones sending up the advice to the people that sit on the committee positions. So that's wiping house, cleaning house as well. And the other thing he said was, I want to reestablish confidence in the Vaccine Safety Committee. We got to start over. We got to start somewhere. He's been criticized for some of the people he's appointed. I get it. Some of them have said some controversial things over the years, but let's give it a shot, everybody.
How do you feel about Robert Malone?
Well, he's one of the guys I was thinking about. Malone, I know Malone very well. He's a smart guy. I really believe he will use objectivity in evaluating stuff. He will take the position very seriously, as all these people will. But let's keep in mind, remember Gruber and Krauss, the people that I think they were on the FDA review committee for vaccine safety. They resigned because of the rush to mandate. These were two of the finest people they had. These were the ones that really were the high-quality vaccine professionals. Off the committee, no one said a peep. How come they're not freaking out about that? Why didn't the New York Times go crazy about it? Stop reading the New York Times, everybody, please. They are a biased, unthoughtful group of people who really don't know what they're talking about and behave as though they are thus saith the Lord.
May I ask you a question real quick? Sorry, real quick, because I'm a normie, meaning this is not my wheelhouse. I'm not an expert on vaccines, so I just want to kind of get my flaws out of the way. What's the issue with Malone? Why is Malone considered controversial?
Some of the stuff they brought up yesterday, I didn't even understand, to tell you the truth.
I didn't either, Doc.
He has said some things that sounded sort of problematic, and he has made claims about his patents on the mRNA platform, and as soon as you say mRNA platform, Maha goes crazy,
right,
and therefore he's tainted by that. So he's tainted on both sides.
Got it. Okay.
Here's the biggest problem with Maha, in my opinion. Where's my camera? This is my camera? It takes the bureaucracy in Washington is insane. It's insane, and nowhere more so than HHS, NIH, CDC,
FDA.
There's so many different layers to it. Give them a chance. It's going to take a minute to get them to get some change underway. And I have most faith in Jay Bhattacharya.
Oh,
Jay,
I love that guy.
Jay, you should,
he's awesome.
because the fact that man who was subjected to a devastating takedown by Francis Collins and Anthony Fauci in their email, we must subject this fringe epidemiologist, decorated professor, fringe epidemiologist to a devastating takedown. That man is now the head of that NIH. That is poetic. That is Shakespearean. And he's a brilliant guy. Go ahead. I'm sorry.
No, I just want to echo what you said.
Yeah.
I love this guy for his immense courage because in the depths of the pandemic, he had the audacity to say maybe shutdowns, complete comprehensive shutdowns aren't a good idea.
Off with their head. Go to no kings, but off with their head.
Yeah.
And he said it in the most respectful and most well-researched way possible.
I know Jay very, very well now, and he told me, when he did that, he goes, I just was giving my opinion. He goes, I was so naive. I just thought, well, we'd talk about it, and we'd each give our opinions. This idea that we had to eliminate, we had to actually take down people who were peers as opposed to engage in the usual scientific discourse was so shocking to him. It took him about 6 months to really realize what was going on.
And some of the official policies that were in place were just so ridiculous. I don't know if you guys remember some of these, but one was that if you were going to have family gatherings over the holidays, obviously they were restricted, but you weren't allowed to sing. Because apparently that propagates the virus faster. So you needed to sing under your breath with a mask. One thing I just want to say really quick, Doug, I just want to celebrate how far we've come. The fact that we're even on this panel right now having this conversation, because it wasn't just the professionals. Any dissenter was completely deplatformed. Even people who wanted to speak the truth unapologetically, they were limited in their capacity because if they did speak the truth, their platform would have been entirely removed. So we had to speak in code, we had to be cryptic. Like, we couldn't even literally say the word vaccine injured.
Yeah, even
COVID vax. So we've come so far, and so we have a long way to go.
Well, we have
a long way to go. The fact we can speak about this in an open forum, I just want to celebrate.
Well, what is okay, so I agree that there were definitely mistakes made during the pandemic, obviously, and there was a lot of hysteria. People were afraid. I personally don't think individuals intentionally pursued policies because they are bad people. They wanted to do bad things.
No, they just showed themselves to be bad people by virtue of what they did.
But I also agree that the scientific debate wasn't really allowed. And honestly, I kind of fell into that hysteria because people were scared. People were scared.
It was not allowed for a reason. And the reality is the evidence has come out, and Doug, please correct me if I'm wrong. That Fauci and team knew pretty darn early that this was a gain of function research baby.
That I agree with, because it was so obvious that they were trying to hide the ball when it came to the lab leak theory.
Okay,
and that's a problem.
Ask yourself why,
right?
And then what comes after that, right? So now we're not looking at existing medicine to be used as a therapeutic. Doc, isn't that protocol? What do we have that would work? And not only are they not looking at it, they're deplatforming doctors who are utilizing things like they're trying ivermectin, which was relatively benign and won a Nobel Prize. And our good friend, Dr. Sabine Hazen, ended up finding out that it did help mitigate cases of severe COVID. I still don't have a TikTok because I posted a clip of her on there talking about ivermectin as a therapeutic. Why? Why did we accelerate pushing this vaccine through the emergency use loophole, knowing while the NIH was doing research on the vaccine injured, like brand resin, another perfect example. So why do we think this is happening? Just
May I add one more quick thing? If I'm not mistaken, please correct me if I'm wrong, there were already patents created for some of these vaccines
for mRNA
in 2019.
As though they knew something.
Exactly, before the pandemic even officially kicked off.
You guys are going full dark on me.
I'm sorry, Doug.
Well, okay, let me add to that, because the mRNA, I guess, technology, the platform, that was developed years in advance in Canada, if I'm not mistaken.
Well, we were looking at it for cancer primarily.
Right, exactly.
Because it was dangerous.
That's why it was the rollout of the COVID vaccine was so quick, because the platform had already kind of been discovered and created.
But not for this.
Let's not forget the fact that the Biden regime clamped down on every single influencer, every single media platform.
No kings.
To say that you can't mention any doubts about the COVID vaccine. And it extends beyond that.
Right?
Can't mention. Also, this is like unrelated. Hunter Biden's laptop can't mention certain things because otherwise you're an agent, you're a merchant of disinformation.
Wait, hold on. Stick with who was behind what you just said. So when you look at the Virality Project, it was funded by Bill Gates.
Oh, you're going so dark.
It's the truth, though. Doug, it's the truth. Okay, so just tell me if I'm wrong. I'm not going to tell you.
I don't know. I try not to go down those rabbit holes.
Unfortunately, I'm telling. Do your own homework on it.
Yeah.
So the Virality Project was in fact funded by Bill Gates through Stanford, and it was benevolent. It was meant to suss out vaccine hesitation. This is what went to the White House, and this is what was used to strategically silence dissenters, including the Facebook group of Brian Dresden, who was injured online, just so people who were vaccine injured could connect on this. That said, who was invested in this platform? Who was invested in this tech? Who stood to lose hundreds of billions of dollars if it didn't work?
Pharmaceutical companies.
Jillian,
And also Bill Gates.
Let's complete the circle.
Just saying.
Because you bring up an excellent point, and I know some people out there get annoyed when I make the connection, but who is one of the biggest donors of the Democratic Party? Bill Gates. And now Melinda Gates.
I thought you were going to say pharma, and I was going to say they donate to both, Lindy.
Well, no,
you're
Bill
right.
Gates in
I hear
particular.
you. No, you're right.
Reams of money. When Harris was in trouble in October, he came, there was a huge New York Times headline about Bill Gates coming in for the rescue.
Okay, so here's the other thing, though. So you have the COVID vaccine. I get that there were issues with that, especially when it comes to censorship.
Mandate.
But then, yes.
The mandate was the problem.
But the other thing that's happening simultaneously as we speak, right, is this increase of like measles cases because now parents aren't getting their children vaccinated for measles, right? So it's like a very difficult situation to navigate as a normal person who doesn't really know much about vaccines, but you want to do the right thing for your kids. And I think there's a lot of fear out there. So Dr. Drew, how do you respond to that? How do you...
Well, wait, hold on. Don't go there yet, because you took me to the next entrance.
Okay.
So very good point. You bring up...
I'm happy to talk about it.
You're about to. You're about to. So here's what happens next.
I have so much more, though.
So you're going to, because they're connected. But at the same time, all right, Kennedy has demanded that we don't, or he's demanded gold standard safety testing.
Yes.
He said we haven't had it. In response, CNN crowdsourced 256 studies claiming he was wrong. So now this would be the studies clip. It's a Google Doc, if you can pull that up for me, and just scroll. So basically, there's 256 studies on here that they have crowdsourced, okay?
Okay.
Now, can we pull up Kennedy's response to this? Because here's the concern, right? You've got parents who are saying, I don't know, I noticed a difference. And you've got Kennedy saying, we don't have proper safety testing. And then you've got CNN going, he's a liar. So this would be the Kennedy tweet, if you see that, Nat, where he responds to this. Do you have it, the Kennedy tweet? Hold on. Okay, good. Scroll down. Yep. Okay, sorry. Hold. Perfect. Okay, here we go. So he says basically he wants gold standard research, right? Then many vaccine promoters have challenged this assertion, saying that there is proper safety testing. Last week, CNN, which has devolved into a shameless propagandist for Big Pharma, triumphantly announced that it had proof that my pronouncement that there have been no placebo-controlled safety trials for any routine vaccines was false. CNN gleefully claimed that it had 257 placebo-controlled studies for routine vaccines. And then he breaks down how this is baloney. So let's go with it. And Doc, you'll respond. CNN is wrong. No routine injected vaccine on CDC's schedule was licensed for children based on placebo-controlled trials. In instances where a vaccine was used as a control, you know what, this is going to be too complicated.
It's a lot.
Okay, so here's what he basically says. Correct me.
Yeah.
You take it.
The easy way to think about this is, and I really want to keep it clear, because they're going to start parsing through the science. They're going to work their way through it. The easy way to think about this is there have not been good studies. There certainly weren't good studies before the stuff was released.
Pre-licensure.
Yep. And there have never been studies on cumulative effect of vaccine. So as we go from 8 to 38 or however many we have now, that cumulative effect is completely unknown. Completely.
Such as the booster, you mean, or just over time taking different vaccines?
The fact that we have so many vaccines on the vaccine schedule that are essentially mandated, we have no idea if together they have a cumulative effect that is different than individually. Zero idea. And many of these vaccines are on the schedule for, somebody's got to explain to me, maybe they can, seems like spurious reasons. For instance, for COVID for kids is ridiculous, but okay, that's now been taken off.
Right.
Hepatitis B. I was involved in hepatitis B research in the early 80s. We were interested in it for pregnant women because in China, they had a massive problem with vertical transmission, mother to child, in unknown people who didn't know they had hepatitis B. It was a massive problem in China. That was where we were targeting the hepatitis B vaccine. Suddenly it comes over here, is we get it through and it's approved, and we're using it in healthcare providers, people that have high risk of exposure, IV drug users. All of a sudden, a child has to get it the moment they come out of the womb. The moment they get out of the womb. Why? Why are you giving that to a child?
I still have the scar on my arm because I was born in China, by the way. It's on my, you can see the indentation.
When was that mandated?
But in today's world, there is a zero probability that a mother with hepatitis B, that the delivering physician doesn't know she has hepatitis B. That child will get the hepatitis B vaccine.
Right.
Why does every child in America get that vaccine the moment they take their first breath? There's zero indication. And I brought this up to my son. We have a new granddaughter. And he brought it up with the pediatrician, and the pediatrician said she could get stuck with a needle.
Yeah, on the playground.
The child does not walk yet.
Yeah.
Why can't we delay it? What are we doing? If she goes into healthcare or she becomes an IV drug user, by all means, let's get it for her. But why are we doing this now? And does it have any effect with the other vaccines? The 9 other you're giving today? We have no idea. Who put that on the schedule? World Health Organization. Everybody? Is that a group we trust?
Which we have withdrawn from now, correct?
Correct, because
they're incredible. That's again more progress.
I guess I realize this is my starting point, everybody. I realize I can trust nothing in the media anywhere.
Yeah.
No matter what. So you can't even do your own research because you have to be skeptical of everything. But you can just at least not trust what you're hearing. And now I can't even tell who the good guys and the bad guys are anymore. I can't even tell what's right and what's wrong.
I didn't even know.
Hold on. Okay, I want to give you a little more information, and then I'll go 1, 2, 3. All right, and Doc, please, since you're the expert here, chime in.
All right.
So I actually went to Dr. Joel Warsh, who is a pediatrician, and he has his MS in epidemiology. He wrote a book called Between a Shot and a Hard Place, and I was like, Doc, what is this 256 studies? Is Kennedy wrong? He's like, it's all nuanced, just in the verbiage, which throws people off. So, for example, if Kennedy was wording this accurately, he would say the following, which Dr. Drew already pointed out. There was nothing done pre-licensure of the vaccine, number 1. Number 2, he's talking about an inert placebo. This means saline. Whereas many of these placebo trials are used against what's called an active comparable, like a previous vaccine, for example.
Yeah.
Okay, so
how is that a placebo then?
It's really a head-to-head rather than a placebo control.
Right.
But they are in fact calling it a placebo trial.
Right.
But hence the nuance, right? The next question is, what is it being tested for? So some of these are for efficacy.
And for how long?
Yeah. Some of them are for efficacy, like, well, 10 years later, it still provided immunity. Some of them are for immunogenicity, to see if the body, built antibodies.
Not did they work or not, just did the body respond.
Exactly. And very few, if any, are for long-term safety. None of these are looking at 10 years, 15 years, 20 years to look for things like autoimmune conditions, autism. And listen, this is not a hill I want to die on. I'm not suggesting by any means, nor do I have the expertise to suggest that this is or isn't related to autism. But the point here is, and over half the friggin' vaccines on that list are not even on the friggin' schedule. This anthrax is not on the schedule. So the point is, Kennedy is right in saying there is no pre-licensure, inert, placebo-controlled trials that are looking at long-term safety. Fact, period, end of story, go.
Well, so what do you say to someone who wants to do the right thing by their kids, right? And they want to get their kids vaccinated with the vaccines that make sense, but this is all leading to a lot of confusion. And quite frankly, I'm actually very, very concerned that an increasing number of parents in this country are refusing to get their children vaccinated for the important vaccines because of all this confusion, because there is absolutely corruption in these government agencies. There's no question about that. So like, I don't look down on or begrudge parents who are like, I don't know, I don't want to hurt my kid, I'm not going to do any of this, because it is confusing. However, there are important vaccines for them to take,
I agree
right?
with you, Doc.
It's funny. I used to have disdain for people that wouldn't vaccinate their kids.
Same.
And now I'm like, understand that there's some big philosophical sweeping things to think about here. Centralized authority in medicine is a catastrophe. Work with your doctor, find a physician you can trust and work with, somebody who's ideally board certified in whatever the field is you're looking for, with pediatrician for kids, and work with that person and make sure that person's listened to you, your needs, your values, and if they do not, if they're dismissive, new pediatrician. But you should be taking vaccines. It's not that you shouldn't. You may want to take them in a staggered fashion, so try to avoid too much exposure
I've
time.
heard this
I understand
quite
that.
a bit, yeah.
And there are certain ones you might want to not take, like COVID and hepatitis B. Guess what? COVID, you would have been right because it's now off the vaccine schedule.
Right.
So who was right 6 months ago? You were an anti-vaxxer because you weren't going to take a vaccine that's now been shown to be useless or not necessary. And so the whole idea of mandating healthcare, mandating what you do to your kids, mandating what you do to your body is so pathetically opposite of how healthcare is supposed to be done. And then that's one philosophy is physician and patient. That's your unit. Anything above that, I have grave concerns about. The other thing is always remember, I was raised by a family practitioner. My dad was an old family practitioner, and he hammered into my head, medicines are dangerous. Medicines are dangerous. I didn't take an antibiotic until I was 15. I remember the day I did. He brought home some samples in like a syrup bottle. He goes, all right, here we go. Your pediatrician wants to do it. We got to do it, I guess. And I just remember that day. I'd never been exposed to a medicine ever. Tylenol, nothing. And medicines are dangerous, and we've lost track of that completely.
We have lost track of that.
We've somehow
sure,
believed that medicines are only going to make life better. No, there's no free lunch in nature. They have huge risk always, including vaccines. And when the risk reward is worth it, then you take that risk.
I mean, my
Cost-benefit
mom is, recovering from bone marrow cancer, right? And so I donated my stem cells to her. She has my bone marrow now, and she's doing well. But the reason why she got bone marrow cancer is because it was a side effect of one of her medications.
Wow.
Yeah.
Here's the thing, the doctors are incentivized.
It was like steroids for her kidney.
Oh, just steroids.
Okay, hold on. I was going to go to Lindy.
Yeah, sure. I mean, just one quick point. It's just this is the issue that you have when it's a for-profit healthcare system. They are incentivized to create lifelong medical patients.
That's true.
Yes. And the proper checks and balances aren't always in place.
They're also not taught.
You've disempowered the one person that's there to protect the patient, and that's the doctor. That's it. You got to empower that unit. And we've lost it completely. Physicians have no power.
Folks, we can't have this conversation without asking who is funding the New York Times, who is funding CNN. And I can tell you right now, it's Big Pharma. And that's why they raised hell when RFK Jr. said, let's ban pharma advertising on TV, because that's where their bread is buttered. And we got to follow the profit motive. And as you said, these people want lifelong patients that they can milk for the rest of our lives. And I'm just like, what you said right now just gave me chills, that medicines are dangerous. I've had firsthand experience with people just like losing everything, like losing their health because they opted for the wrong side of the risk-reward analysis, But
that's why having a doctor who you trust.
Who's thinking about it, making the decision. This is why you can't grok it and get the right answer. You have to, you see a doctor because of our judgment, not because of our knowledge. You assume the knowledge base, and you can look everything up today. So it's not knowledge, it's our judgment of applying that knowledge in a given situation, given the value base, the religion, the circumstance, the age, the feelings, the input of the family, all the aspects of that individual, trying to make that decision on behalf of that person in that circumstance. That's what you're doing.
Can I ask you a quick question, really quick? How do you find that person? We did a segment last week where we're talking about how AI is being so overused. I saw a video on X where the person is filming over their doctor's shoulder and they're checking with ChatGPT. So many people are either indoctrinated by the medical industry or they just don't care. And they've used AI, and now these are starting to become some of the doctors. Do you have any tips to actually find somebody who's good, who you can work with?
It's really a mess right now.
It really is. Like, I've struggled to find a good GP.
You usually can. Most of them are concierge, unfortunately, now.
Yeah, they are.
But you get what you pay for in this day and world. But you have to really use your own sensibility and judgment about that. The not caring, particularly post-COVID, has been out of control.
Yeah, I also want to know, when my doctor prescribes me something, are they getting a kickback?
No, that's impossible.
I just like, what
How would you get it?
They're not.
They don't get.
Think about how would I get a kickback? How would that
ask
happen?
this,
But hold.
because I was prescribed birth
Consulting
control
fees or
in 2018.
speaking engagements is what
Wait,
she's thinking of.
so like I was prescribed birth control not because of sex or anything, but because I had an eating disorder, and she said it would jumpstart my period.
Yeah. So
She put me on hormonal birth control,
which is
ruined my
reasonable
life, by the
because
way.
with anorexia you can get premature ovarian failure, you can get osteoporosis.
Well, I had
you get-
amenorrhea.
Yeah, you get all that stuff.
Right, and so I'm being very, hopefully this helps somebody else, but
Yeah.
it ruined my mental health. And I went to her and she's like, oh, it's, maybe, she implied that I was imagining it and that I should just
No.
see how
Don't ever.
No.
When a doctor says you're imagining something,
That's crazy.
Change immediately.
Right, but I
Immediately go
feel like
somewhere
I
else.
wasted 5 years of my life, and I'm just wondering, why was she so insistent on this drug? I'm very curious.
There's zero probability that she makes any money from it. There is every probability that she wants to move on to the next patient right now.
Yeah.
And she just has to keep going, move. And she has confidence. She was trained. The training we get, you have to understand, the training we get is a little bit culty. We are trained from on high, and we do it over and over and over and over again. That's thus saith the Lord. And we are trained not to question our superiors, the people in the academic infrastructure. And if you step back and think and take a minute, it takes time, and we don't have time.
So my life was just collateral damage for her schedule, basically.
It's a little, to say it that bluntly, I don't want to go that hard on it.
It was very difficult.
I blame the system.
Yeah, the system has problems big time.
She should have gone. I mean, did she refer you to anybody else? You
No,
can always
I went to her repeatedly saying that
you
I
can
had
always
anxiety.
refer it out. If you don't have time, get somebody else involved.
May I
here.
jump
One more thing I would love to ask you, Doc, just while we're on this topic.
Before you ask, though, because it's going to change the topic, and I want to just add more to like what Lindy is saying, because right now there's this trend happening. Oregon just banned it, which is great, but we need like a nationwide policy that prevents private equity firms from buying up.
Yeah, that's going to go bad.
They're buying public hospitals, nonprofit hospitals, and when they do that, they introduce a profit motive into those hospitals, and they ensure that it's as efficient as possible so they can maximize profits, so doctors don't get to spend enough time with their patients, and it just kind of becomes like a factory, like
I
move
can
them
tell
out.
you stories that would blow your mind if we have time. Because I worked in a for-profit hospital, and the problem again wasn't the for-profit hospital; it was the insurance companies.
Yep, that's the fourth pillar of this kind of catastrophic quartet that doesn't get a ton of attention.
But did we finish?
Sorry about that, Amy.
No.
I just wanted to say, so I was having this vaccine debate about the COVID vax like a year ago, 2 years ago. And so many of the people that I was debating were saying that the vaccine injury report on the government's website, that is not seen as a credible source to make an argument.
It's also
Tell me,
significantly
So
underreported.
what can we do then? What systems could we put in place to act? Because there were hundreds of thousands of those, and they weren't deemed as credible reports.
I know. Listen, that VAERS has been a catastrophe. But I get overwhelmed trying to answer that question.
I'm sorry.
Because I've seen a lot of vaccine injury, a lot. We are just beginning to be able to say those words out loud without losing our license. It's becoming very difficult to sort out who's a vaccine injury, who's a post-COVID, who's both, because everybody's had both, most people. You can certainly look at the nucleocapsid antibodies, and if somebody only has spike, that's not a post-COVID, that's a post-vaccine. And there are growing groups of those. I interviewed a number of these doctors, McCullough, Jordan, Vaughn, longcovid.com. All these people have huge populations now of post-vaccine injured. They will come up with some published data. We'll begin to understand that. But VAERS, let me just give you an example of VAERS. So James, I'm blanking on people's names right now, but there was a study group that had included a rheumatologist whose child had a child that just died of a vaccine accident. He reported it to VAERS. He followed it up to VAERS. He got Dr. Marks on the phone and said, I've been reporting this death, And Mark goes, I guess it slipped through the cracks. Normally a death doesn't slip through the cracks. What are you going to do? It's like, this should have been a holy shit moment. A child's death didn't even get acknowledged by us. I can tell you, the elderly patients don't get a lot of vaccine reaction. My patients wanted the vaccine, they took it, they took the boosters. One had a reaction. She was 99 years old. She had a life-threatening reaction. She didn't want to go to the hospital, so I had to manage the whole thing at home. Thank God I got her through it. She died at nearly 101. Wow. But when she was 99, about to turn 100, she had this reaction. I reported it to VAERS. Thank you for your report. Here's your report number. We will follow up with you. I followed up again. I followed up again. To this day, no follow-up from VAERS. Wow. It was a life-threatening, severe reaction that went down as insignificant.
Can I put a button on this? And Doc, correct me if I get anything wrong here, obviously. But to answer your one question, Anna, that I forgot. So in 1986, Reagan gave the pharma companies blanket immunity on vaccines, so there are no downstream consequences. After that...
If they're on the schedule. Yeah, if they're on the vaccine schedule.
Oh, wow.
After that, we went from 3 routine injections by age 1 in 1986 to 25 routine injections by age 1 in 2025.
I didn't know Reagan did that. That's terrible.
Reagan did a lot of things, huh? I'm just starting to learn more about all the amnesty he gave that created Reagan.
With
laws of unintended effects.
Yes.
Laws of unintended effects.
With that said, it's what do we do? What do we do? What do we do? What I've taken away from it, speaking with doctors like yourself, is you educate yourself so that when you go speak to a doctor, you can ask the right questions and you'll know right away if they're full of baloney. I interviewed Dr. Arthur Agatston, who's a cardiologist that created the calcium score. If I go to a doctor and they just take my blood work and make a determination that I need statins without doing a calcium score, I'm like, oh, you have no idea what you're doing. Thanks for playing. So the more you educate yourself, the better able you are to find that right doctor to work with you and explain things to you. And I would also suggest that there's a huge amount, as mentioned, of nuance here. And utilizing that doctor, you can say, do I need Hep B? Well, no, but maybe you want whooping cough. Like, you can play out the cost-benefit analysis more effectively. But you have to educate yourself by listening to people like Dr. Drew, for example, and then you can find the right professional that will work with you. Thoughts on my conclusions, Doc?
100%. That summarizes it. I only have 2 things that sort of flew out of this conversation for me. One is, when we saw Dr. Paul Offit this morning saying the fact that it's off the schedule for pregnant women is going to result in lawsuits against the federal government. I thought to myself, oh my God, he doesn't even know how the practice of medicine works. It would not be against the government, it'd be against the providers and the insurance company. The federal government have nothing to, so he has no idea about clinical medicine. I just realized that he revealed himself this morning.
Right.
So say what you will about whether it should or shouldn't be on the schedule. It's a controversy, we'll get it sorted out. But the other thing, and I think this is a bigger topic for me that I'll bring up a few times today, you mentioned the word hysteria. We have become hysterical in this country.
Yes.
Hysteria, and the world. The whole world is hysterical.
Yes.
And I think hysteria is the enemy right now. You have to be I have some deep thoughts about it. We'll get into it. But if you feel yourself becoming hysterical or the media is making you hysterical, please avoid that, because it will have you make some bad decisions that you will not like yourself, the decision you made afterwards.
Dr. Drew, you bring up a really good point, because you said the doctor had no idea what he was talking about. A lot of times people don't, but they're suddenly a medical expert.
The people that learned how to say the word hydroxychloroquine the next day had an opinion about whether it should be used.
It's because their
That's
political
crazy.
tribe told them to say that. And
Well,
so they
that's
adopted an
hysterical.
entire menu
And
of
the dogma
thoughts.
of big pharma trickling
And the
down
media,
into
the media.
Well, what about hydroxychloroquine? Was that proven to work against COVID?
I am not a huge fan of ivermectin, hydroxychloroquine. I use Paxlovid when I need a pharmaceutical agent.
But it wasn't there in the beginning, Doc.
It wasn't. However, I would go to the mat to protect my peers, for them to use that if that's what they think is in the best interest of the patient. At very minimum, that doctor is going to follow up and see that patient again, and not say to them, come back to the hospital when you're blue, which is what we told patients. Jeez. That was the most disgusting chapter in medical history in this country, as far as I'm concerned. But hydroxychloroquine, I happened to be doing my rheumatology board reviews right at the time all this controversy was breaking out around hydroxychloroquine. I thought, I've been prescribing this stuff for years. I've never seen a single side effect. All my mild lupus patients get it and stuff. And I was using it at one point for travel. And I was on my rheumatology question. It's a series of questions I answer. And one of the questions was, should you maintain hydroxychloroquine when a woman is pregnant, a lupus patient? And the answer was yes, because it's completely inert. And I thought, oh my God, that is the only medicine I'm aware of that's recommended to be continued during pregnancy because it is so benign.
Interesting.
So.
Okay. And last but not least, I think your other question is, how do you know? Well, if we get off Kennedy's back and let him do the studies that he wants to do, non-conflicted, we may have more answers.
And if you want to hang your hat on somebody, Bhattacharya, just lay your flag down, put your flag right there, and then see what comes around him, and watch that. So.
Bhattacharya runs the NIH.
Yes,
just
runs
for
the
anybody
NIH.
who is unsure.
Yes.
All right, moving on. Speaking of hysteria, cuts to Medicaid and food stamps have freaked everybody out right now, but apparently this cuts both ways. Cheesy pun intended. Now, can you pull up that clip of Bessent and Warren, please? Take a look.
You don't want to answer the
question.
No,
Senator, I am answering it.
No, you're not.
And what I want is for Medicaid to be used for mothers and children as it was meant, not for 1.4 million illegal aliens, not for able-bodied people.
You don't want to answer the question.
Okay, Lindy, go ahead.
Well, okay, this situation has been explosive, to say the least, because Democrats are accusing Republicans of throwing millions of Americans off of Medicaid and Medicare, and which is just not true, because work requirements is not depriving people of care. Work requirements is ensuring that, as Bessent said, it goes to people who actually need it, not people who are able-bodied and able to work a job but choose not to. And honestly, 80 hours a month is not, asking for too much. And there's something to be said. Work requirements is something that Democrats embraced during the era of Clinton, but suddenly it's a bad idea and a bogeyman because Trump wants to do it. And Mike Johnson, not just Bessent, but Mike Johnson also is hammering away at the fact that Democrats is dangling the prospect of Medicaid, the prospect of driver's licenses, the prospect of social, all these benefits in the eyes of legal aliens, and thus attracting them to these blue heavy states like California, like New York. And then they blame Republicans for saying, are you doing this? This goes to a topic we're going to discuss later. Are you doing this just to juice up the population figures for the upcoming census? I don't think it's much of a, it's not a stretch when they constantly shove these benefits down the throats of these illegal aliens. And it's basically saying, like, it's shoving out a welcome mat and saying, come here.
Least of all that, what about like the $10,000 prepaid card that they
there
got
you go.
when they arrived?
Well, wait, stay on point,
no,
though.
sorry, I'm just saying.
A lot of these are
She
interconnected.
is correct. It makes sense. Why it's connected is because the incentives have been intentionally contrived to bring in these type of people. The right incentives in this country do not exist to make sure that we have the right immigration process and policies.
But wait, hold on. Stay on the cuts to Medicaid and food stamps right now. I agree with you, and we're gonna get into that in another show. But right now, people are outraged. I can't remember how many hundreds of thousands of people are going to lose health care because of this. And no one really understands why they're losing health care, or at least the people that I end up in arguments with don't understand it. And I'm just trying to explain it beyond the fact of really understanding for myself whether it's considered good or bad.
But these are work requirements. It's a choice that they make.
I'm not suggesting you're wrong, but Doc, what becomes of this then, do you think? Who gets hurt by it?
All I know is I now start to present myself as a time traveler. I come from the past. I travel into the future to deliver messages in the present. Whenever I give public lectures now, I'm always thinking that in my head because I have very strong opinions about addiction treatment and things based on decades of experience that have been sidelines. So I'm here from the past to tell you about how things should work. But that's, But I'm going to say some words that I did not expect to say in 1996.
Clinton was right.
I miss Bill Clinton. I really miss Bill Clinton.
I saw you react when I brought it up.
I really miss Bill Clinton because he had a massive reworking of the welfare system based on this principle.
Yeah.
That you just have to do. Work is good. It's important. People need it. And we've set up a system that denies the reality of the human experience, including incentives and what people need in order to be healthy and good and engage in the world and be a part of a society. It's okay to ask people to do something.
Exactly.
to get their
By the way,
privileges.
it's not just work requirements. They can go to school.
Yes.
They can do community
it is-
service.
I cannot say this
Are we
strong
going to
enough.
litigate undocumented though, or are we going to talk about cuts to these two programs because they are two separate?
I'm just saying that asking people to work, asking people to go to school or volunteer in their communities, it's not an imposition. It also just helps bolster their sense of humanity and dignity. It's good for the community. It's good for them.
Good for them.
And by the way, I love what you brought up about the time traveling because literally they said this. Democrats wanted this. Even during the era
all
of
part of
Obama.
that unrecognizable
Now it's
Democratic
like
Party.
just
Yes.
like so many other issues like tariffs and whatnot. They are staunchly against it because Trump has adopted it.
So that's
as
hysteria.
Based
That's
on
hysteria.
studies of Medicaid recipients at this current moment, no one who's on Medicaid, with the exception of undocumented immigrants, we can talk about that later, but no one who's currently on Medicaid, who gets Medicaid, qualifies for Medicaid, would be kicked off of the system under this policy. However, I think it's really important. Like, look, sometimes we get into like conspiracies, right?
For sure.
And so I want you to think about what's actually happening behind the scenes, like what the motivating factors are of that particular focus on cutting Medicaid. Right now, that big, beautiful bill, think about what it does, right? It has major tax cuts. It extends the tax breaks for working class Americans, yes.
The 2017 tax cuts.
Yes, the 2017 tax cuts. But it also disproportionately benefits wealthy political donors who want additional tax cuts. They want to save more money by not having to pay the federal government their taxes. So right now, with a $37 trillion debt that we're dealing with, and the fact that we're paying $1 trillion a year just to service that debt, Republicans are like, oh my God, I want to do this favor for my donors. I mean, that's what they paid me for in my campaign. So what can we cut? And they're hyper-focused on things like SNAP. Those are the food
I wanted
stamps.
to get to that one.
That, and also Medicaid. And honestly, those cuts are not in any way, shape, or form going to even come close to paying for the tax cuts. And I just think it's messed up because, look, I'll give you some numbers. I'll give you some specific numbers. If Republicans think this isn't going to hurt them politically, they've got another thing coming. Because at this current moment, there are 80 million children, senior citizens, people with disabilities, parents and adults without dependents relying on Medicaid, okay? When it comes to Republicans, more than 60 House Republicans represent districts with higher than average Medicaid enrollment. I think that there is this defamatory claim about Americans, low-income Americans who need these programs, where people think that they're like bums who don't want to work. There have been studies into this. The majority of them do work. Those who, and those who don't work.
Then wouldn't they not get cut? That's where I get confused.
Okay, I'll answer that question. I'll answer that question. So I don't have a problem with the work requirements. And in fact, the way that provision is written, it's not extreme. However, what ends up happening is, think about the number of elderly people or people who might get discouraged by the process of proving that you're working, right? You have to set up a whole bureaucracy in order to do the checks to make sure this.
Why is it really that difficult?
Yeah, they've done this before. They've literally done the same policy before. And it ended up kicking a ton of Americans off of Medicaid because, look, for us, it might seem super simple to like, oh, whatever, I'll log into whatever this thing is, I'll report and I'll provide evidence that I'm working. But there are a lot of people who don't have either the capability or even the computer and technology to do that. It becomes an obstacle that ends up kicking people off of the system, even though they qualify.
But that is similar rhetoric to saying that people who don't have voter ID because they don't know where the local DMV is.
Yeah,
it sounds like
I know. That sounds super patronizing and ridiculous. And I would agree that it applies to, Medicaid and this policy that they're trying to pursue, except it's already happened. And it showed that a lot of Americans who do, in fact, qualify for Medicaid ended up getting kicked off the rolls as a result of that policy. I do not like the idea of my fellow Americans who need this social safety net getting kicked off the system just because these wealthy donors want these tax breaks and they're looking for savings. By the way, one other thing. I have to add one other thing. Right now in the Senate, where they're debating the big, beautiful bill, you want to know what Senate Republicans specifically are focusing on cutting out of the bill entirely? No tax on tips, no tax on overtime.
That would be catastrophic.
It will be catastrophic.
That would be catastrophic.
So look, guys, whatever you think about the social safety net, really need you to think about the motivations for why these provisions exist in the bill. That's all I'm saying.
So you're saying it's simply, at the end of the day, they're doing this to balance the budget, or to give an illusion that the balance is the budget is going to be balanced.
Exactly.
In reality, it's not really going to yield any results, and this is all just a guise to push through the big beautiful bill.
Well,
Yes,
That's your position,
Yes.
essentially.
The counter
I'm
argument
going to Dr.
is-
Drew after this one. Go
The
ahead.
counter argument is that there's asking people to file the proper paperwork is not too much of imposition, just like when you want to vote, it's not too big of imposition to, I don't know,
to the
present your
DMV.
passport. Exactly. Go to the DMV, find a way to prove that you are actually a citizen. And also, how do you give tax cuts to people who don't pay taxes, the 40% who actually don't? So it's not too much to ask for integrity in the system to ensure that everyone who's actually on the program deserves to be on the program. I actually don't think it's the essence of what America used to be, like personal responsibility. Because right now we have a humongous welfare state and just simply unsustainable.
We do have a humongous welfare state that overwhelmingly benefits pharmaceutical companies that Medicare is unable to negotiate
consistent
with.
on that.
I know, but like if we're going to have a talk about our government resources getting wasted, which, by the way, there is a lot of waste, there is a lot of abuse, the fact that our Medicare system cannot negotiate pharmaceutical drug prices, I mean, that is an injustice. And if we had changed that, that would save far more money than
Those are the
that.
pharmacy benefit managers in the middle that work for the big insurance
But nothing's
companies.
being done about that.
There was
should.
an
We should.
executive order on that.
I know, but you can't do it through executive
No,
order.
I understand, but it's starting. It's moving that way.
You need,
What I mean is
unfortunately, you
you
need
can't-
Congress, and
But it
Congress
is
has no
specifically
interest in
for
legislating.
Medicare and Medicaid.
Yeah.
It is specifically for that. The one concern that I took away from that, and this is from Brigham Bueller, Doc, who I'm sure you're familiar with through the Maha channels, is that insurance companies can then turn around and say, okay, well, who's got the lowest cost for, let's say, insulin? Oh, all right, in that country, it's $10. We're going to make it $20. Now we're meeting the lowest cost, America.
So they're going to
Enjoy.
increase prices for
so
everybody?
It's only, but anyway, we are working on it. There was an executive order to start to deal with it. I would ask you this, because on one hand, I agree with the girls. I'm like, you should have to work. It's free.
And by the way, let's remember what work is. It's 80 hours per month. That's what they're asking.
I know. But on the other hand, you're giving me the data saying, yeah, but it didn't work.
Right.
And vulnerable people are exposed.
When was that?
This happened, I think it was under a previous Republican administration. I don't remember the exact dates, but it was also challenged in the courts, and the courts threw it out. So there is going to be legal challenges in regard to this policy. And again, there's a false assumption that people who are qualified for Medicaid at this current moment are just lazy bums who aren't working, when again, multiple studies show the majority of them are working. Those who don't work are taking
But
care of
the
elderly
majority,
parents.
right?
Hold on, are taking care of elderly parents, or they're going to school, meaning that even
don't get
under this
cut, though.
provision, under the big beautiful bill, they wouldn't get cut.
Right, okay.
Everyone who's getting Medicaid right now qualifies for Medicaid. It is
For the most part.
For the most part. I'm sure there's like a few isolated incidents of fraud, right? There's definitely a lot of fraud in our Medicare system with these like adult daycare centers that end up charging, like focus on that. But focusing on the most vulnerable Americans who need help.
Oz is on that. He's on the Medicare fraud. But so I'm the only one here that uses these systems. So both I'm a Medicare patient and I've been a Medi-Cal provider for many, many, many years. Medi-Cal is Medicaid, just in California.
Yep.
It's a horrible system. It doesn't work. Providers can't use it because it's just impossible. You don't get paid for anything, essentially. Anybody that needs Medicare gets it. And if you can navigate the Medicare system, you can navigate the Medicaid system, trust me. So Medicare is insufferable online. I can barely find my way through it. And for elderly patient is a legitimate problem. They don't know how to do an email.
Right.
So, but they do it. Figured out there are armies of people ready to help them. Same thing with Medicaid.
Isn't that what navigators are for?
There are armies of people ready to do it. So they get through the system. They find a way. See, when you say elderly, you're talking about Medicare, Medicaid, two systems. Both.
Right. No, I know
they
there's
get the Medicare automatically.
Right.
And also, it's complicated. This gets a little bogged down because many of the people who aren't working and are on Medicaid are really mentally ill. It's like seriously.
Yes, exactly.
And they're not. They're on, and they may be on disability also. So there's
I
all
didn't
kinds
consider
of,
that component at
there-
all.
there's-
Able-bodied would also include taking into account
Mental wellness.
psychiatric capabilities, mental health.
Yeah, exactly.
All of those
No
things.
one's
But
asking.
there- it gets in the weeds. It gets very complicated. It really.
Yeah.
Does.
I mean, I'm sure it could. I completely agree with you, Anna. We do need to be able to provide some safety net. My issue, and especially coming from Australia, where there's private health, but it is largely socialized healthcare system. And we're getting to the part now, and I've seen people come at me for saying this before, but just fact check, do your research, especially outside of the major cities. People are dying, waiting for ambulances now.
That's true.
Like, people are literally not getting the care that they need because they've become so reliant on the government. The budget is not balanced, and they don't have the same resources
about
to
Australia?
throw towards it. Yes.
Oh, yeah, I'm
Could
sure.
we end up in that same position
absolutely.
if we bring in all of these people, provide so much socialized care without proper checks and balances?
Listen, the way insurances operate now and the way socialized medicine operates, they want, not like they desire it, but they want you to die waiting for care rather than delivering the care.
What?
Absolutely.
Can you elaborate on that just a little bit? Because I got destroyed in the comments for saying this previously in one of our shows.
So let me give you
treat
two. Do you really want to get into the weeds on this?
Let's
of
do it.
course.
Let's do it. I do want to get to.
I think that's a
few of the
really
other ones,
good
but
point,
let's do
though.
it.
Let's-
Let's do it.
let's
If
wrap
you've
up
got the
with that.
time,
So
Doc.
I have two stories. One was I ran a very large drug treatment center for a long time, and early in the days of the HMOs, when they were getting going, there was a high-quality physician that set up one and was working on it, and we were seeing his patients, and they were mandating that these are alcoholics. They were mandating discharge at 3 days. They were relapsing. Finally, I called this guy. I go, look, my staff is demoralized. We want to help these people. You name your price. I will care for the patient across our services. We'll do outpatient services. We'll do all kinds. And he goes, no, I just want a 3-day detox. I go, what do you mean you think they're not going to go out and relapse again after 3 days? He goes, oh, no, they may relapse. But if they relapse 3 times, then they're no longer my concern.
No.
And these are Medicaid
he literally,
recipients?
this is a HMO.
Oh, okay.
And he literally said these words, I'll never forget it. I'm an insurance agency now, not a social agency, so I can't tell you whether that's good or bad. I almost threw, I just was like, I couldn't, it was the most unbelievable moment for me. So that was one moment.
Insurance agencies.
That is devastating.
Insurance agencies, though, are behind.
Now here's this. So now
Medicare,
let me give you
Medi-Cal,
another one. This is a
Medicaid.
little more involved. So,
Same thing.
So as time went on, all the insurances started mandating people leave the hospital. But before they were ready, some review doctor in Chicago would be reviewing the case, and they'd go, "You patient, get them out. You don't have to meet the criteria." What criteria? Our criteria. Okay. I sit with the patient. I go, "You're going to come into some real expense here. You're an addict in trouble. I don't want you to have to incur that. Let's figure out some place where we can put you and get some care for you." I'm not ready. I'm in withdrawal. I'm suicidal. I don't want to go. I go, your insurance company is not going to pay after today. I'm going to call my insurance company. Call the insurance company. The insurance company goes, oh, Mrs. Smith, if Dr. Pinsky would just tell us what you need, of course we'd provide that. They don't tell the patient, you have to meet our criteria. I explain the criteria thing. The patient leaves. Let's say they go home and commit suicide. The insurance company then goes, we don't practice medicine. There's Dr. Pinsky's order right there.
Wow.
He discharged the patient. We don't practice medicine.
You're talking about
So I've been
exactly.
in situations like that. I
Yep.
made a complaint to the California Insurance Commissioner. Next thing I know, I'm getting called in by the hospital administration, freaking out because the insurance company is going to decertify the entire hospital if I don't shut up.
Wow.
Can I strongly recommend everybody watch an interview with Brigham Mueller? He explains the evils of big insurance, so much so that when doctors order preventative tests, they will whip up the DOJ to go investigate that doctor for healthcare fraud. It is insidious. And what I was telling you briefly earlier is that it is these same exact insurance companies, Medicaid, that is a United Healthcare, Blue Cross, same
Well,
game.
United actually is one of the biggest providers of Medicare Advantage. And there have been a lot of issues with that where they do not
disaster.
authorize.
Yep.
But that is the type of situation in which it's publicly funded but privately run. And so they look to basically deny authorizations, whatever, to increase the amount of federal money they can put in their pockets.
Exactly.
Like, that's a huge problem.
You got
Can we
it.
slightly bring this?
You nailed it.
Can we bring this slightly back to the original topic of SNAP cuts and Medicaid cuts? In that, we got to remember why we're here in the first place, and that's just the albatross of national debt. It is we are suffocating under this tremendous burden. We pay upwards of $1 trillion each year just to service our interest, which is just astounding and breathtaking. Like how much longer can we remain on this trajectory?
Not much.
Exactly, and I just want to say, just because you say that fraud on Medicaid isn't substantial doesn't mean that we don't go after it. And I agree that that beautiful bill has a lot of issues, like they cut I'm against cuts to solar credits. I think we should have them. I think we should cut subsidies to companies like ExxonMobil. I don't think that should happen anymore. But just because there are bigger cuts elsewhere doesn't that mean that we should also just jettison cuts to
In
Medicaid.
2017, I do have a problem with it because I think what they're prioritizing here in terms of cuts says everything you need to know about our congressional lawmakers and what they prioritize, right? So I find it hilarious. They're like, oh my God, we're in so much debt when the yearly defense budget gets passed with increased defense spending with no debate at all. Like, you want to have a talk about what's contributing to our debt? The Medicaid system is like far down that list compared to how much we spend on defense and other things. The lack of revenue that we're going to bring in as a result of the major tax cuts to the rich. I remember in 2017, Trump said, look, I want to simplify the tax system. So I'm going to do these corporate tax breaks, right? The corporate tax rate was 35%. He's like, I'm going to lower it to 21%. However, I'm going to close the loopholes, the corporate tax loopholes. He didn't do that. And that created a situation in which companies as profitable as Amazon were able to get away with paying zero in federal taxes.
And it's terrible, but our system is binary. It's not like, we're not comparing ourselves to God. We're comparing ourselves against literally the Democratic Party. And because it's not, you know what I mean? It's not the ideal. We can't have the ideal or the Republicans. It's basically the Republican plan or the Democratic plan. But I do want to say that let me give you the alternative. The alternative is somebody like Joe Biden, who
shouldn't be though, Lindy.
But it's just reality, though.
Issue.
It is a systemic issue.
I'm just describing reality. Let me tell you what the Democrats did under the Biden administration. They withheld SNAP benefits, food stamps, by the way, for people who aren't clear.
This is fair.
They withheld food stamps from schools and public school students who don't have much. They withheld that from schools who refused to allow biological males in girls' bathrooms. Okay, and I sent you that. I sent that. I sent Nat that link. Or
Can we see that? I didn't know that. I want to see that.
Wild.
I appreciate you pointing out that hypocrisy.
Yeah.
I think you're absolutely right. And the fact is, like, everyone's running around being outraged, but yet their own team pulled this. But you know, the part that's so frustrating, and it's something that we were all talking about before the show started, is like, you said this about Trump. You were like, listen, some stuff's good, some stuff's bad. Some stuff is like, I don't know. I mean, and they're all kind of like that. And they're incentivized similarly.
He proposes things that I think could be good. So when you're talking about closing the corporate tax loophole, I'm all for it, but you have to deliver. I'm in favor of the car loan interest rate deduction, because that's going to help working people. The question is that on the chopping block in the Senate right now? Because what they're eyeing in terms of cutting, provision-wise, are all the different provisions that help working class Americans. So you do that in addition to cuts to the social safety net, you're going to make a lot of enemies, number one. So if you're thinking political strategy, Republicans better wisen up. But the thing is, we have so much corruption baked into our political system. And so there's this like tug of war between constituents and corporate donors.
It's also bigger than corruption right now because we have to look at the macroeconomic situation right now. We are in the era of tariffs and we're still in that 90-day period and Trump is feeling nervous. He's here. He's getting called up by his big donors, these corporations. So I'm just explaining what's happening here. These walls, like people like Jamie Dimon calling him up saying, stop the tariffs right now. So he's already under pressure to cave to these corporate interests. It's going to be impossible for him to close any corporate loop. This is not a prescriptive statement. I'm just explaining.
No, he's not going to close corporate loopholes. I mean, that was never a priority. Let's keep it real.
They put out the Maha report. And it's like, oh, environmental toxins, points right back to Big Ag. And Big Ag went bananas. All of a sudden, it's like, well, you can keep your illegal workers and don't worry about your chemicals, glyphosate. We're going to take that off of this bill in Texas that was going to get banned on. And all of a sudden, concessions. And just to speak on something that I understand uniquely with regard to things like SNAP, we spend $500 billion, I think, over the course of a decade on these GMO crops. That's our money, our subsidy dollars to big ag. And then we spent 40% of Coca-Cola's income comes from our money, our subsidy dollars via SNAP and the Women and Children program. And so if you took these, what ends up being trillions, and maybe redistribute it to the people in a different way, the system is just, where do we net out here? Give me something hopeful.
Well, hey, the House passed the rescission bill.
Bright light.
The House passed the rescission bill. It's going to the Senate.
She means
see
the
what
Doge
cuts
cuts,
they
like
make.
they're-
all of the
okay.
cuts, that would be something that could substantially help to balance the budget. It's a little white pill.
The good news I'm taking away is we're not Australia.
Okay.
Oh, yeah.
Yes.
That's the good news.
All
Hey,
right.
that's the good news I'm
another-
taking away.
I
That's
have
why
another
I live
glimmer.
here. Okay. That's why I live
I
here.
had another ray of hope, kind of.
All right.
And we
Last
can
ray
end
of
on
hope,
this.
and then we'll move on.
So right now, RFK Jr. is trying to ensure that all the SNAP benefits don't go to soda and candy and junk food.
Yeah.
I actually think that's a really welcome development.
Yes.
But thank you, Dr. Drew.
Yes,
But
I would
Democrats are up in arms saying, you know, this is like patronizing. This is,
Racist.
exactly.
Ableist.
And
It shouldn't matter then. It shouldn't matter. If it's patronizing, they shouldn't need that encouragement, so it shouldn't bother them at all. Let's just do it.
Exactly. But also, we have such a, we haven't even talked about the obesity epidemic in this country.
But it's
and
all
the chronic,
tied, though.
Right.
That's what's, I think it's
the food
80%
pyramid
of the
and
people on SNAP are on Medicaid by design. And there is a vast divergence with the people that are on SNAP in the same demographic with those that aren't, who's on Medicaid. Obviously, the ultra-processed foods that it subsidizes makes people sicker.
Right, and we all end
Common
up paying
sense
for it because if
dictates that.
someone ends up in the emergency room and isn't on insurance, who foots the bill? We do. So we are all in this together, folks. And I know it's sometimes easy to forget that in this era of extreme division, but we all end up footing the bill for everybody. We are one team.
I would argue that that's one of the important steps forward lately. Is I feel as though what was Musk's organization called again? The Doge. The
Department of Government Efficiency.
Doge got people thinking about what do I want my taxpayer dollars to be used on. I mean, we didn't think that way for the last 20 years. And now people are going, now somebody said 40% don't even pay taxes, but even there began to realize that this could be done more sanely than it had been done. In particular, all the corruption and USAID and all the kind of grift and everything. People are like, they're outraged with how our government
the food
behaves.
pyramid is a joke, and it's not healthy to
100%.
load up on carbs, and it's just ridiculous. So I know that corruption exists. There's no question about it.
Extreme corporate capture.
Definitely. But to your point, Lindy, I agree. I mean, the most expensive healthcare system to have in this country is one in which people who don't have healthcare have no choice but to wait until they end up in the emergency room, and that ends up costing a lot more. So we want to make sure
Again,
people...
that's complicated too because people on Medicare only use the emergency room for their health care.
Well, that's a problem.
So it's like
Medicare or Medicaid?
Medicaid, I beg your pardon. It's a big old mess. The thing about MAHA, one of the things that bothers about MAHA is they really aren't talking about the healthcare system. They're talking about helping people get in a condition where they don't need the healthcare system.
Prevention.
We really haven't even scratched the surface on the healthcare system yet.
I agree.
All right, moving on. I got another,
It's a lot, guys.
another
It's
happy
a
one.
lot.
Okay. Surely we've all been made aware of bioweapons caused through gain-of-function research, COVID being an arguable perfect example. That said, China has been buying up, follow me here, we're going to connect the dots. China has been buying up U.S. farmland at an accelerating pace. As of 2021, Chinese entities owned over 384,000 acres of American agricultural land, a number that's only growing. Now, some of these purchases have occurred alarmingly close to U.S. military bases, which raises bipartisan concern in Congress and triggers multiple state-level bans, but not in California. Sorry, sidebar. Now, add this. In 2024, U.S. Customs and Border Protection, along with the FBI and the CDC, intercepted a shipment from China at Detroit Metro Airport containing a genetically engineered fungal bioweapon. I can't even pronounce it. Bavaria bassiana. It was concealed inside mislabeled containers. Now, this fungus, while naturally occurring,
How did they get on this? How did they find it? That's what I
Doc,
wanna know.
had been modified in a Chinese lab to evade detection and survive extreme conditions. According to federal sources, it posed a significant threat to U.S. crops, food security.
Terrible.
Speaking of, potentially functioning as a covert agro-terrorism weapon. When you pair these two developments, control of American farmland and attempted smuggling of bioengineered agricultural pathogens, the implications are simply chilling. And Amy brought this to the table today.
Yeah.
Take it away.
I mean, we can play this video in a sec, but I'll start. There have been more recent incidences than the one that Jillian just mentioned, and that's what really brought it to my attention. So it was a couple who, the woman, she is at the University of Michigan, and they were caught trying to smuggle in Fusarium gramineum. It's obviously very difficult to pronounce, but similarly, this poses a massive threat to crops, to agriculture. It can even cause fatality in infants and children. Causes, I believe it's liver damages to human beings as well. Just a couple of days later, it actually happened again.
Oh my
Same
God.
university.
I didn't even realize it was a separate couple. I thought it was the same one until you told me.
No, there was a second incident that took place just a couple of days later. This is a Chinese national fresh from Wuhan who was arrested at the same airport. He was shipping parasitic roundworms to the same lab in...
Did you say Wuhan?
Let's remind people
Yeah,
what
this person
Wuhan
is from Wuhan. Yes, exactly. I mean, that's where the COVID virus came from, people. Listen, you do not need to set bombs off to start a war, okay? Yeah. One thing that I think the Chinese are excellent at is warfare without ever firing a single weapon. And they do it through medicine, they do it through agriculture, and they do it through psychological warfare. You pair that, cyber attacks too, you pair that with the fact that they're buying up all of this farmland. There's a video, I believe, that you should be able to pull up, Nat, but it's currently less than 1%. But again, the main concern is how disproportionately close all of these are to very important bases around these United States. This is a theory.
Mossad was just able to activate itself from within Iran, practicing the same principles.
There you go.
That's how they did it.
Can I just say absolutely how shameful this is? The Chinese Communist Party, they're pieces of shit. Let me just be very clear. They killed my great-grandfather. I hate them with a vengeance that I cannot even describe.
You're not going to get a debate on this one.
I'm getting heated right now. My body is emanating heat. I want to say also, like, these Chinese spies, please just chill. Like, just stop. This is so bad for the entire Chinese American community. It's so bad. It's escalating hysteria and racism against all of us when we have these random shitbags doing this to our country. You need to stop, like, please.
Well, I don't think it was benign. Do you think it was benign of them? Like, surely, if this was something that was a controlled research project, they would have been able to submit those.
I think they should be, like, deported is a nice word to use.
Right.
People, but this is what I'm trying to say is this gives people ammunition and reason to clamp down on immigration from China. And I'm just saying that these people, it redounds back to the entire community here, the vast majority of whom are law-abiding and America-loving. But these people, they are the enemy of the American people. We should do everything we can to stamp them out and to ensure that everyone who comes into our universities, who take advantage of elite institutions like Harvard and Princeton and Yale, that they're actually coming here to stay and to invest their knowledge base into our country rather than bringing it back to China and growing their economy. Why should we waste Harvard's very precious resources on people who are just going to leave a few years from now and then help the Chinese regime?
And what is the vetting process? Because not even were they just random Chinese people.
I'm so sorry.
They found CCP propaganda on her laptop. So these weren't just benign Chinese people. They found the Chinese Communist Party propaganda on her laptop. They are active members of the CCP. How do we allow this to take place?
Well, let me broaden the discussion just past this, bioweapons thing, because in regard to foreign entities buying up farmland in the United States, residential real estate to basically park their money or launder their money in the United States, which, by the way, in the middle of a housing crisis, it should be banned. It should. My point is, both political parties are 100% full of shit when it comes to this issue, because none of them have called for banning foreign entities. Well, that's on a state level. So DeSantis and Greg Abbott. I'm talking about a federal level.
I was thinking on a state level. I'm with you.
And by the way, I give Abbott and DeSantis a lot of credit, but they only seem to focus on China. I think there needs to be a broader ban on foreign entities or foreign business interests buying up properties here. The other thing I'll say is, I was really disturbed to find, because in his first term, he was pushing back against this, that Donald Trump approved the merger between Nippon Steel, which is a Japanese company, That Japanese company bought U.S. steel.
But it's an ally, you know, so that's the way.
I don't care. I don't care if it's an ally.
I'm just saying that's how he's justifying
I don't care. I don't care. We need to protect property and businesses in the United States. Full stop.
I actually agree with that 100%. It's not
Devastates
just
communities.
it's not just property though. Natural resources and
Yes. Yes.
That's what it is.
rare earth minerals. You know what China did when we embarked on the trade war? They clamped down on exports to the United States on rare earth minerals. We cannot be at the whim of the Chinese when it comes to these vital, but especially these vital resources. And it's not just property though. It's the water we drink.
Okay,
you know what I
there
mean?
it is.
Well, wait, really quickly,
we've talked
Lindy,
about this
you
once
are
before.
echoing my sentiments, though, because that's something I wanted to say. This is speculation, but what if this is retaliatory from the CCP against Trump's tariffs? You don't know. And I mean, and even if that is a jump, we should still treat it as such. This should be treated as such an extreme matter of national security that they look into this to the highest degree, because even if it's the worst case scenario, and that's unlikely, they should still be preparing for that.
What did these
think it's unlikely
individuals
at all.
say, like when they got caught with these bioweapons?
So
right?
at first they denied it. At first
Okay.
they denied it and said, oh, someone must have put that in my bag. They actually wrapped them up in tissues. And then later, after they were, thoroughly investigated, they later admit that they hid them in the tissues because they believed that would more likely ensure that they were concealed and they would not be caught. So
Why
they
would you bring
admitted-
this,
They
though? Why would you bring
admitted
it? Well-
because they said it was to continue their scientific research experiments in the United States.
wouldn't there be
Had-
documentation of that?
Exactly.
And
Had
like a-
that been sanctioned, then they should have been able to do that, no questions asked. If it was a program between China and America, for example.
Right.
Okay, so hold on. Doc, I want to go to you here because you and I have actually had conversations about bioweapons like COVID. We talked about bird flu. There was some talk about whether or not Lyme disease had been a creation of gain-of-function research.
wow.
And
Yeah, there's good evidence to that effect.
Yeah, this is
Which
sweeping
shocked
and
me when I
broad.
saw it.
Wow.
And now you're seeing it with agro-terror, essentially. Where does this go? What are your top concerns? And what should we do about it from a personal perspective and a government perspective?
I mean, it's above my pay grade. But let me just say what concerns me. What concerns me is the interwoven quality of all this, where we're engaged with it, we're pulled into it, we're supporting it, we're allowing it, we're supporting it. And so I think we ought to take some very, very specific, and I heard Jay Bhattacharya talking about this. We're going to take some very firm positions on gain of function. No more dangerous
Trump
research.
signed that executive
100%.
order, but then I ask you, like, what about we've all seen Tulsi Gabbard say, hey, there's a bunch of these labs in Ukraine, FYI.
But this at least gives a frame to go after this stuff and not be involved with it and
Got
sort
it.
of be half measures. Let's stop it worldwide, and let's just start there. And then and in terms of preparedness, again, you'd have to be imaginative to understand what's out there waiting for us. But I certainly, back to hysteria, should something happen, be more like Winston Churchill than some of the people with the megaphones out on the streets this last week. Don't be hysterical.
And focus on the real enemy.
Right.
Be clear,
Focus
be
on the real
careful,
enemy,
be
not Chinese
systematic.
immigrants.
Watch the real enemy, go after them
Vote out your
carefully.
governors who block
we
these
need
laws.
clarity about
But
all
the
these
problem
things.
is, again, I mean, we have this issue where this two-party system has politicians who don't want to do anything about this. They might rhetorically say they want to do something about it, but their actions don't prove it.
Could I please just say one thing really quick to Anna's point? There is something right now called the PASS Act. This is a bipartisan bill that would ban foreign adversaries, including Chinese, from buying U.S. farmland near military bases or critical
to get on this.
infrastructure. It's simple, necessary,
and-
long overdue. Call your local representative and say that you want to see this done.
There's no
they very
reason
rarely
why.
get calls. If they get 10 calls from their constituents saying that this is important to them, that could be enough to strike fear that, hey, next time election comes around, maybe I won't get voted in. Vote for this.
The other thing, Chinese money is getting in all over the place.
This is what-
And you need to call that out wherever
That's
it is.
exactly what I was
Speaking
gonna
of
say.
Chinese money, by the way, there's no reason why this bill shouldn't pass. There's no reason why we
exactly.
shouldn't
But
have
this
this.
is
what Jillian, just to what you both said.
So let me,
That's why
let me give you a
interest.
Newsom example, because of course,
Oh,
who's the
Newsom.
biggest
Yeah.
scumbag on the block? So we've talked about this a little
You
bit
guys
before.
don't mince your words.
Oh my God,
Chinese
I
brand
loathe
shit
him.
bags.
I mean, if you could, I'm fine with you applying that label to him as well. So this guy started China SF when he was mayor of California.
Yeah.
And he's like, oh, we're going to commingle the economy. It's going to be great. But all he ended up doing was facilitating their ability to buy real estate.
Yep.
And then when a bill landed on his desk to block their ability to buy farmland, he vetoed it.
Yep.
Period. And it is directly connected. All the players with China SF.
If he runs for
like
government,
Vincent
bring
Lowe,
that out big time, everybody.
you mean run for
If he runs-
president?
if he runs for
ties to the
president.
CCP are highly questionable, and somebody should do a deep dive on this. So this guy, Vincent Lowe, was associated with China SF.
Yeah.
Turns out this guy is directly connected to the CCP. A lot of things Newsom does somehow, some way, connect back to the CCP, and this is a perfect example. And as Californians can't get a friggin' permit to build a shed on their house, he clears all the red tape for them to buy real estate, buy farmland, and build in California, and that's the calling out.
One word reason why: money.
Yeah.
Because they funnel money into his campaign
We're
coffers. And
running
there's
out of
something.
time, and I want to hear about Gen Z and
Well,
sex.
okay, so
One quick thing, one final thing in this China stuff. It's not just bioweapons and cyber war, and it's also anchor babies.
Oh,
These
yeah.
mother
They clamp down on that, though, at
Right,
least in California.
but there's still people doing it
I'm sure,
around the
I'm
country. They
sure.
come to the country just to give birth and to ensure that their babies are Americans and thus,
didn't know they clamped
eligible
down on it.
eligible
Yeah,
to
California did.
a U.S. passport,
California did?
American
Yeah, I did
benefits.
not know
Believe it
that.
or not. Well,
But this
county
should-
by county.
Yeah, I was gonna say.
Orange County was a big outlet, and
This
they
should-
clamped
But
down.
this should not be happening. These moms, these families have no allegiance to the United States. We should not be allowing this practice. And it's not just China, by the way.
It's the Constitution. You're never getting through that whole birthright citizenship thing.
There are literal industries around this of women
They had to
who
clamp down on the
Yeah,
birthing. They
this
have
is
a name
wrong.
for it, birthing something.
I did
birthing
not know
center.
that.
anchor babies.
Yeah, but,
Okay.
but these places that do it are these or houses and
Yeah,
these
it's like a
obstetricians,
literal
these Chinese
cottage
obstetricians
industry.
go in there and just deliver baby after baby after
Jill,
baby.
I'm not talking about like one-off instances.
No,
This is like a
I know.
orchestrated-
It's a business,
I saw
yeah.
Trump bring it up, and I saw all the pushback against it because it's like
No.
it's the it was the 14th Amendment.
But
Is that what it was?
They
yeah.
always cry the
But-
Constitution.
I know, but I
Well,
saw
the Constitution's important.
I
Lindy.
understand that, but no,
It was important. That's why free speech is an issue, and why
hold
keeping us
on.
in our homes
Richard-
was unconstitutional.
All right, hold on.
Whatever.
All right, so Gen Z, we teased
right.
this one for a while. It turns out that, thanks to Anna pointing this out to me, that there is strong emerging evidence Gen Z is indeed less sexually active, dating less compared to previous
womp.
generations.
Yes.
What's going on, guys?
So many things.
Okay, I can't wait to hear what you
This
have to
makes
say
me
about this. But
sad.
first, let me set it up and give you
Yeah.
the deets. Okay, what's going on? So
Can we go past can we go over?
we can if you can,
Yeah, I
Doc.
go over, yeah.
So
Okay.
there have now been multiple studies indicating that
a big topic.
young men, and I'm talking about the ages
Can we
when
do
they're
it
like.
point by point as you're bringing these things up? Can I address them as you bring
Sure,
them up?
sure.
'Cause
So let
each
me-
of these things have layers to them.
They
Let's
do,
go.
they do.
Young
So
men.
I'm gonna
Young
give
men
you-
first. Let's talk about them.
We're going to talk about young men
Yeah,
first, and
okay.
this has to do with their sexual activity.
Yes.
So
You need to define young so we can.
yes, I am.
Good point.
So let me do it uninterrupted so I
Okay,
can get it
sorry.
out.
Beg your
Okay. So Indiana University, for instance, did a study, and they found in their study of men between the ages of 18 to 24. So we're talking about the time when they like really want to get it on, usually,
Yes,
right?
Yes.
Only one in 3 of them reported no sexual activity in the past year. 1 in 3.
Yeah.
So 1/3 of young men in that age group, no sex at all.
Yeah.
And I want to know why.
What's the comparison point? Like what happened
what
20
were they
years
normal?
ago?
What was the
Yeah, 20 years ago, what was the rate?
I don't know the
I promise
comparison
it was
rate.
higher 30 years ago.
Oh, yeah.
Published in the Archives of Sexual Behavior, the study is the first to include such a comprehensive assessment of diverse sexual behaviors. The information came from U.S. participants ages 14 to 49 during 2009.
14 to 49.
Yeah.
Interesting. 2009?
No, between 2009 and 2018. So this is a long-term study that they did.
So, and by the way, it's worse since COVID.
Yes.
COVID
Okay.
made it
Oh,
worse.
yeah, completely.
Yes. So there have been other studies showing that this was even more pronounced
Yeah.
after COVID.
What's the mechanism there?
Really, before you go,
Many.
doctor, can I just say one quick thing?
Please.
I blame feminism. Listen, Tinder just put out a height filter. What I can say about this
Girl,
dating
that is
market
not feminism.
is women
hating on the short kings is not
but
feminism.
women believing that they should be empowered enough that they can create their own custom-built men, that they deserve everything, don't need to work for anything, whereas men, they need to build up their income, their body, their physique,
Their height.
their personal development. Apparently, that's the one thing they can't build up, right? This dating market is totally rigged for women. And I think that's why guys aren't getting laid.
But Benny Johnson said this to me, and then I'm going to stop talking because I definitely want to hear from Dr. Drew, but he's like, the world was a better place when men had a harder time seeing boobs. And I kind of wonder.
Okay,
anyway, okay,
my bad.
That's another layer to it. That their men are just, okay.
Too much porn.
So let me just,
that is my question.
Let me quickly clarify the study, okay? Because it wasn't a long-term study. My bad, I misread this. So they did the study in 2009, and then they did the same study in 2018. Yes, so to compare. And this is what they write. So they say, compared to adult participants in the 2009 survey, adults in the 2018 group were significantly more likely to report no penile vaginal intercourse in the prior year, the researchers found. Study participants were also significantly less likely to report engaging in any other sexual behaviors, such as oral sex or, other things.
Anything. Yeah.
All modes of past year partnered sex were reported by fewer in the 2018 cohort. So it is a growing problem.
Oh, yeah. And so we know birth rates are plummeting, right? So people are not forming pairs. They're not falling in love. They're not having sexual encounters. There's some data that shows that the apps are leaving a 5 or 10% zone of men that are having lots of sex. And they're the ones that
super
are super users, and they're actually hurting people. They're hurting women. And women I hear a lot from women, where are the men? Where are all the men?
There's a term for that.
There's
They're called
men.
fuckboys.
Well, you have
Literally,
vilified being a man. You have vilified it. I have been around the Gen Z and the millennials for quite some time. And what I saw was men fearful of being seen as toxic or trying to rape. They just withdrew. And if God help you, if you offer a girl a beer,
I'll take the beer.
I would too.
I'm a married woman.
I have a friend that got kicked out of 2 bars in New York for buying women drink. 2 different bars.
Are you serious?
It's considered predatory.
Wow.
So men are scared shitless. They don't know what to do. Then because they're withdrawing so much, they first of all don't feel worth. They're being told they're not worthwhile. They're particularly young white men are told they're bad, they're evil, they're the source of all problems. And they don't develop the skills necessary to communicate, to determine what they want to do. And they turn to porn.
I was going to ask you
and
that.
the porn gives them unrealistic expectations about everything. And they sort of take the position like, I'm fine, I got my porn, I'm fine. And for the first time, I did a show called After Dark for a few years over at your mom's house. And I started hearing about, from young men, something I had not heard all these decades talking to young men, the use of prostitutes. They were starting to turn to prostitutes because they had no other option.
And not only that, but OnlyFans, because OnlyFans, especially in today's generation, young women are literally getting excited to turn 18 so they can create an OnlyFans because they are seeing other women out there portray this lifestyle. And you know why they're oftentimes portraying it? Because there are affiliate programs attached to OnlyFans where if you recruit other women, you make a buck
pyramid scheme.
off of what
that's
they make.
terrible.
It's a pyramid scheme for
Where are
sex.
the parents?
This is the prostitution
I have the
aspect
answer
is becoming
to
more
that
and more
question.
normalized. And it's not just that. They're not only buying these women's pictures, but then their managers are messaging them, building parasocial relationships with these men.
The parasocial relationship thing. It's huge.
It's sick.
So Dr. Drew, one last question, because I hear you in regard to culture and how that's changed and how that impacts, relationships in America. I am also curious about the impact of social media and how increasingly people aren't actually meeting with their friends in real life, communicating face to face. So when you don't have that, there's like a difficulty in communicating when you're trying to, seduce someone into a relationship.
All of it speaks of no experience, no skill.
Right.
I remember back in the 90s, I used to be, the hookup culture was the big thing. And I kept saying, you're not happy doing this, I can tell, because you're always drunk when you do it. And I was advocating dating, where you just sit down, enjoy time with somebody, learn who you are, learn who to break bread, whatever. Don't have all these expectations on every time you go out with somebody. That needs to come back again. That people need to hang out in person, in flesh with people a lot, and just enjoy that and develop a skill and start to figure out who you are, what you want, and who other people are. But this vilification of the young male has gone out of control. And they're pissed. And I'm worried when they come out of it that they're going to
I have a confession.
Adam said
like
the same thing.
A big confession. Okay, so look, every woman is different. So I don't speak for all women.
You don't?
I don't. But I also have a problem with like some women, who have engaged in that, rhetoric in regard to men, kind of speaking on my behalf, because I'll just talk about my preference. My preference is masculine men, like traditionally masculine men. That's what I'm just attracted to. I can't explain why. It just is what it is. So this like push to make men meek is unfair to women who don't want meek men either.
I don't know
But-
any women who truly want that,
very
Dr.
few
Drew.
people
In fact,
want
from
that.
an evolutionary perspective, the
Doesn't make sense.
masculine guy
Right.
thing, I remember
Like if
seeing
I'm on a
little study-
train or if I'm on the metro and there's someone who's threatening my safety and there's a bunch of men there and they just kind of sit back and let it happen, that's a freaking problem in
But the
society.
thing is,
That's right.
there's a huge demographic, to your point, who does celebrate wife guys, right? Like, remember how they elevated Doug Emhoff because he was all feminine and happy to be behind Kamala Harris? Do you remember that?
Well, they
type
do
of
it
thing?
for women
no one's
too,
hot for
though.
Doug Emhoff, though,
But what I
in real
mean
life.
is, that's the kind of man
That's a
the one-
psyop, Doug Emhoff.
I mean, look
You
at
know
look
what?
at
No one is hot for Doug Emhoff.
That's not what I'm saying. Is that's what they're celebrating as the archetype. And Dr. Drew, since you're here, I want to bring a medical component into this,
Okay.
and that's the use of Propecia and finasteride.
Yep.
I was going to ask you that.
is that
Could it
birth
be
control?
plummeting
So-
testosterone levels,
So
hair stuff?
here are the
Right.
It
things.
blocks androgens, which I'll let the doctor do
So
this.
Propecia and all these medicines do drop testosterone.
And millions of men
And they
are on
drop
it.
libido. And in about 20% of cases, it never comes back.
Oh God.
So when that was documented about 10 years ago, I had to call all my patients on Propecia and say, do you still want to continue? Most of them did.
But
I would.
What about this?
So-
What about this piece
It never
too?
comes back?
There were
20%.
some reports
10,
that when
20%.
women take birth
Hold on.
control, it
Also,
actually alters the type
it
of
can
men
go-
that they are attracted
or-
to. They are attracted to
Yep.
more beta,
Or it
feminine
drops their
males.
sex
Tell
drive.
me how to fix this finasteride problem. I need to know.
Hair transplants. Get off the finasteride.
No, but what if they're against
TRT.
it?
TRT.
Trust me, I've gone
You
down this
can't
whole...
do the TRT because then they go bald. You see, if they have a problem, then you do TRT,
I've
but they will
asked-
go further bald.
I've
So
researched this extensively, and one solution that was presented was topical finasteride.
Yeah,
but
so-
what
so-
if they have hair currently?
So the high dose Rogaine with finasteride and a steroid is a very effective topical agent. Some of it is absorbed still, but that is an alternative.
But you have a
yes.
bigger problem with crashing testosterone, and we
Yes.
don't know why.
Well,
and
it's all the above, plus obesity,
Obesity's a
testosterone
problem, yeah.
down, estrogen up.
Yep.
There's so many reasons our testosterone levels are down. We need to get back. Resistance training needs to
Yes.
be part of our daily life.
Yep.
Everybody. And it's just, we are unhealthy.
sleep,
and
Dr.
it's-
stress,
you're
weight
referring
management,
to-
lower body training, boosts testosterone
You and I would agree
naturally.
100% on this.
This is music to my ears. I love it. Thank you. Please.
But I have one more big sweeping thing I want to
Yes,
say. But
tell
before
us.
I finish, you finish the
You're
thought about
referring to
finasteride.
post-finasteride syndrome, correct?
Yes.
And you're saying it's incurable, so basically their libido is gone forever.
in
That's
some
what
people.
that, in
He
a
said in
small,
some.
in a limited
that
percentage.
20% you're saying there's
20%.
nothing that can
that's
be
what
done.
that's what some data came out with about 10 years ago.
That's
yes.
devastating news. Like for humanity, the
Yeah, I
fact that
know.
millions of men are on it.
No, you can put that person on testosterone and other things and override it, but then they'll go further bald.
Oh, God.
And so,
Wow.
so
But
it's-
basically, these men are. Let me be clear what's happening here. These American men, and they're choosing their hair over sex, is what they're choosing.
the ones that stayed on Propecia in my practice were not noticing a drop in their sex drive. They didn't notice it. So it doesn't mean everybody has a significant drop in
lot of-
testosterone.
Listen,
but it's
girl.
common.
Vanity is a powerful, powerful thing,
it-
and I get it. I get it. I'm vain. I don't
There's so
mind
many
admitting
things
I'm
they can do,
vain.
though.
If like, oh, you're not gonna have a healthy.
It's healthy for
You're not
you
going to
to
have
want
like the
to
best
care
sex
for your
drive,
body.
but you're going to look 10 years younger. Give it to me. I want it.
I heard the conversation you guys had before the mics heated up. Come on now. But let me just say one big thing. I wanted to address the hysteria thing because I'm a time traveler. Remember that. And I come from a previous time and era. And I worked in a psychiatric hospital where I saw the personality changes in real time in this country. So when somebody's admitted to a psychiatric hospital, this is a follow-on to the comment hysteria. Hysteria is the enemy, and I want to contextualize it. When I first arrived at a psych hospital, I was looking at the admitting sheets. Patients would come in every day, and the personality disorders, so-called, were all over the place. Dependent personalities, obsessive-compulsive personalities, sociopathic personalities, they were all over the place. And I noticed as we moved into the end of the 80s, it shifted to borderline personality disorder. And by the 90s, it was only cluster B personality disorders. So sociopath, narcissist, borderline.
Jesus.
That's it, 100%. And every borderline had at least 10 lawsuits under her belt. They were all females. There's a bias towards women with that. And I thought, wow, this is interesting. And I watched those women move from using the legal system when the legal system caught on and they started slapping them with the cost of the lawsuits that were frivolous and stuff. They became lawyers, they became judges, and they became regulators. And I thought, wow, this is really interesting. And I thought we had sort of shifted narcissistic, which we had, but we moved past narcissism into borderline. And a very close relative of borderline is hysterical, the histrionic personality. And I was listening to Michael Schallenberger talk to a astrophysicist psychologist who framed it this way. I'm going to interview him in about a week. I love him. And this guy's named Vaknin. And he said, originally we were sort of in a psychotic phase where you could hear voices and see things, and you were sort of, no one thought anything of it. You were a religious person. You saw God, you heard God, and it was not pathologized. Then we hit the Enlightenment, and individualism broke out, and we sort of moved into this narcissistic phase. And he said that was the era of narcissism, really like 1800 to now. And he said we moved into borderline now. And the key, in addition to hysteria, the other key feature of borderline is the need to discharge emotion. He said, narcissists, they have rage and they get angry and they pick up a gun and go to war. Borderlines aren't interested in doing anything except discharging emotion. Think about the demonstrations lately. Discharging and making you uncomfortable with their emotions that they're uncomfortable with
Social
themselves.
media.
It's a borderline process.
Oh my God.
We have to
Doc,
contain it.
I came in and with these clips of people at these protests screaming.
Oh, like children.
It's
Like
beyond children.
like babies.
My children have never screamed quite like that. They're just in the face of
Like demons.
And they're like,
Just
and
demonic.
kill yourself, kill yourself. The one guy was like, eat a cock bullet, kill yourself, Nazi fuck. And I was so, I was so disturbed.
That
it
person
seemed like they'd been
claims
infected with
they
something.
claim to be caring and they
Yes.
actually have huge rage that's disavowed and they have to put it out there.
Jeez,
And
Doc.
so-
And it's kind of egged on by the hysteria in the media, right? The simple narratives.
Fueling it.
Did you see the study about
They're
how
probably
I think
also
like
borderline,
20% of liberal women have some sort of mental disorder?
Higher
I
than
would
that.
not.
Higher
there
than
you go.
Over 50.
They seem like it. I'm
Insane.
sorry, but it's like also you're looking at an individual who has a certain aesthetic, and you're like, okay, well, what does it take to let yourself gain 100 pounds, shave your head, or dye it blue, pierce your
Depression.
septum? Like, what goes on for you emotionally? And that there is definitely a demographic that fits a certain
And their
very
childhood.
few brown people, by the way, very few black people at these things. Didn't see one Asian, but I saw a lot of
You're
white
never going to see an
liberals.
Asian there, I'm telling
Yes.
you.
Screaming.
Okay, can I just weigh in on that
sorry.
very, very briefly? Because there was that video that went viral featuring two white people in Brooklyn.
Yes.
Blocking the black woman?
Yes, and this
Yeah.
poor black woman,
I know.
she's like, I'm just trying to get to work, please. Like, she's like begging them.
terrifying.
And they're like shouting her down,
Yes.
basically telling her this protest and what we're protesting about is more important than your job.
We know
you
better
have to
than
go to
you.
work. And it made me so angry
They
because
don't really care.
they
No,
don't
they
really
don't.
care. What they care more about is like
Discharging their emotion.
discharging their emotion, showing everyone their virtue,
Virtue signaling,
right? But it's
yeah.
like,
Which is
let this
narcissism.
poor woman go,
True.
okay?
You know, he made 115 grand, that same guy, off of a BLM protest lawsuit. He was at BLM sued
don't get me
somebody,
started with
got
that.
115 G's in a settlement. But he doesn't really care about black lives when there's a black
absolutely
mom
not.
saying, what about my kids? How do I pay my bills?
So having
Holy
been
mother of
working
God.
3
Disturbing
decades,
stuff.
3 decades in a psychiatric hospital with these personality disorders, they need containment. They're happier, they feel better. We're all happier when they are contained.
What does that mean, contained?
A show of force.
That's what
Like, you have to surround them and you have to go, stop. You're fine. We're going to go to work. You need to stop. You
Yep.
have to, like we started with at the beginning of the show, we were saying, you have to ask people to do something.
Right, right.
You have to ask things of people, and you have to keep your compass right, so you're not stepping on anybody's livers
Dr.
or anything.
What about a healthcare solution to it, though? Because how many of these people
Mama,
need
what are you gonna do?
care,
You're gonna run out and be
like mental
you
health?
don't need to
No,
lose 100 pounds.
no, I'm not saying
And lithium.
I'm not saying on an
You,
individual.
Prozac.
I'm not talking about an individual level. I'm talking about a more systemic level, right? Like,
How?
what if these people have undiagnosed mental
They
health
all
issues?
do, but how do you address that? And there's totally
Well, mental
completely
health care, by the
unconscious.
way,
think-
isn't covered by a lot of insurance companies.
Yes,
People
yes,
don't
and
seek
yes.
it out. Yeah.
Yes, yes, and yes. However, I think what we knew, and I've always thought this was my job, we have to work on the culture, the health of the culture.
Right.
And we have to call things out. Adam said to me the other day, he goes, it's time to settle some hash. And I thought, that's the idea. We just got to like call things out, and we have to know what we know, stand firm, and keep doing what's right and
Amen.
important, and just, you know, men
I'm
need to
gonna have to
date,
button it
men
up
need to be
after this one,
masculine,
team.
men need to be, we just stop it, everybody, stop it,
Yeah.
keep moving forward, let's go.
Yeah.
Thank you.
Well, Dr. Drew, you are fantastic.
We loved having you.
Doc,
I love being
where
here.
where can they find you and get more?
So my biggest show right now is you can find me on Twitter at Dr. Drew, on Instagram at Dr. Drew Pinsky, but the show we do on Tuesday, Wednesday, and Thursday at 2:00 Pacific time. My wife produces it. It really is sort of our crucible right now. We do a show kind of like this, and I just interview really interesting people. It's how I got to know RFK Jr., Bhattacharya, and all the guys, the names you see. I was interviewing them 2 and 3 years ago, going, what is up here? What happened to our profession? I don't.
You're ahead of your time.
This COVID thing does not seem like that's as big a deal as they're making it, and I learned a ton from every single one of them. So you can learn too by showing up and watching the show. Rumble's the easiest place. Also, drdrew.tv, drdrew.com.
Thank you, Doc. Anna?
Just look up my name on YouTube. You'll find everything I do.
You can do
And
that for me
Substack.
too.
Substack.
I was going to say, the Substack's awesome.
Yeah, Kasparian.substack.com.
Lindy, I'm Lindy Li on X. Also, I'm on Manect.
Yes, likewise. You guys can find me on Manect, or you can catch my show, Dangerous Conversations, every Friday.
Thank you so much for watching, guys. Please be sure to like, comment, subscribe, click the bell notification, share. It helps us a ton. See you next time.